We will immediately be trialing a new triage liaison physician role.
It was a promise and a timeline stated not once but 3 times by Alberta's hospitals minister.
These physicians will be added immediately, and I'm pleased to implement it immediately.
That was part of Matt Jones's response to Albertans dying while awaiting care in emergency rooms. But more than a month since that January 15th press conference, there are still 0 triage doctors on the job.
It's not a shock that they haven't found them. If there were more doctors, they'd be working in the actual emergency department.
The NDP alleges that announcement was more about politics and public relations than actually getting more help for struggling hospitals.
It seems like they aren't able right now to deliver on a promise because they probably sat in a back room, wrote something on the back of a napkin and decided to make an announcement and didn't actually have the desire to follow through or the means to do so.
Minister Jones gave a healthcare update to business leaders in downtown Edmonton Tuesday. City News was there to ask him why he has not yet delivered on his commitment.
It's a process. I wish it was faster as well, but there are 2 sides to this process, and we are certainly working in genuine good faith to try to get this implemented as quickly as possible.
Jones says the funding has been approved, but the government is still working with the Alberta Medical Association to hammer out a deal with doctors regarding liability and pay. But the minister expects progress next month when government officials meet with the doctors' union. In the meantime,
we're also going to be looking at other medical professionals who also could be of assistance in the emergency room. So that could be, for example, nurse practitioners. That could be triage nurses. Whatever supports would help our business EDs, we're going to look at that and to implement it.
Some doctors have called the triage role a Band-Aid on a system in crisis. The AMA says the province's offer used an outdated pay model, and there is added red tape because Alberta now has 4 health ministries.
Are physicians expected to now negotiate with 2 different ministries to try and get something going? That, I think that's it's very unfortunate. I think that makes it much less likely that we're going to see this happen in the near future.
Minister Jones says the worst of flu season has passed, but this bad weather with crashes and falls may also strain the system. Sean Amato, City News, Edmonton.